October is Breast Cancer Awareness Month, a time to raise awareness and hope about a disease that has affected far too many of our loved ones. Joining us from Wing Memorial Hospital and Medical Centers to share more about what is being done to make a difference is radiologist and director of the mammography program, Dr. Sanford Smoot. Great to have you here, Dr. Smoot.
Thank you for having me.
Now, October is Breast Cancer Awareness Month, but of course, every month of the year, people should be remembering and raising awareness and hope about this.
Absolutely. It's so important to understand the disease and to identify it. It's very important to be aware that anybody can get it.
Anyone, and even men, you were telling me too.
Even men can get it. And the important thing is early detection, making sure that you follow the guidelines that are offered. It's so important that women at the age of 40 start getting their first mammogram, unless there's a predisposition in the family. Otherwise, some younger women can get it, believe it or not. But the earlier you detect it, the faster you can make the diagnosis and the faster you can get treated. That's where it counts the most.
And also self-exams at home. At what age should women start giving themselves self-exams to check?
Similar guidelines, exactly. I mean, you can have a mammogram one day and 6 months later, believe it or not, you can get a breast cancer. So you may have the false impression that you're safe for a year. Well, the fact of the matter is, it's always important to be vigilant no matter how long or what time interval in between exams. So once a month you should do a breast self-examination. Your physician should be able to instruct you as to the easiest way to do it. And if you feel something that you may not have felt before, you know, address the issue. You know, take care of yourself. Make sure that you go and address it.
So don't ignore something, even if you think it's something very small. You should always be safe and not
Exactly. I mean, you don't want to overdo it, of course, because then that's not necessary. But the fact of the matter is that there's something that you've never felt before, or something that you feel is getting larger. You just don't want to ignore it. You know, you got to take care of it.
And why is digital mammography so important? Obviously, technology has come so far in the past few years.
Well, we're fortunate that technology has come as far as it has, and it makes basically our lives a lot easier to make the diagnosis with regards to mammography. Mammography used to be on film, and now it's available to us digitally, which means that we're seeing all the images on a computer. The computer also has the ability to basically provide a second read for us. There's software out there called computer-aided diagnosis, where you get a sort of a second opinion instantaneously. The machine will just look at it and say, hey doc, why don't you go look at this? You know, I'm not so sure exactly what it is, but maybe it didn't catch your eye, but it certainly caught mine. And a lot of times, you know, you can discount it, but you know, every once in a while, you know, you might see something that you may not have. So it's good to have, you know, somebody being a backup.
It's always good to have that second set of eyes, even if it is a computer,
Anything.
Absolutely.
And by doing that, again, we'll make the diagnosis early. We'll be able to get the person into treatment faster. And if you catch it early, you more often than not will be cured. And that's what we're all looking to do.
Absolutely. Now, what do you feature at Wing Memorial? What sets you apart?
Well, we do have the digital mammography. We have all of the state-of-the-art imaging equipment. We have the, as I said, all the monitors are brand new. They're super high resolution. That's mandated by the government actually to have that equipment so that you can see things that you would not normally see. We have the computer-aided diagnosis I mentioned before, so we'll have that. Plus, we also provide, anytime that there's something that's seen on the mammogram or felt, the ability to provide a breast ultrasound. And an ultrasound is a different type of technology. You're probably more familiar with the fact ultrasound related to taking a look at babies.
Of course,
you know, and but it also can see any part of the body. And what it's super sensitive in is in mammograms and in evaluating the breast. And we can see things with ultrasound that we may not necessarily even be able to see with mammograms. Sometimes the breast is very dense, and we can't see through it, but we can feel it. And once we look at it with the ultrasound, we can identify it, we can target it, and take care of it.
So having all of this equipment really does make a big difference.
Right, and we also have the breast MRI capability. Breast MRI is another technology which is extremely sensitive in seeing through dense breasts and seeing patients that are at risk for identifying lesions that you may not even remotely think are bad. And by having that technology, you know, as part of our armamentarium to diagnose breast cancer is just terrific. So at Wing Memorial Hospital, we have all those services. you know, we do provide, you know, we are a small place. And that's kind of nice because anytime we find something, my technologist comes up to me and she says, hey, Dr. Smoot, or actually she'll just say Sandy, she'll say, what do you think of this? And we'll look at it and I'll say, you know what, I think we better evaluate that a little bit further. We'll take a few more images. We might, then we'll say, bring it to ultrasound. Okay, we'll bring it to ultrasound. We see something we may not necessarily like or something that we're not 100% sure of, and we'll offer up the ability to make the diagnosis.
Yes, so you have teamwork and also you can take action immediately.
Correct.
Which is wonderful, and that's so
nice.
important.
It's nice to be able to be nimble. In the big medical, you know, conglomerate that the United States has these days, it's just nice to be able to offer that sort of service to our patients because, you know, I've worked in many other places and that just does not happen. Go see Dr. So-and-so next month and then the month after, and whatever it is.
Yeah, we all know those experiences, absolutely.
Right, we all have, and so it's nice to have that.
Yes, Dr. Smoot, thank you for being here. You also have evening hours. There's so much that you feature. People can visit your website for more information.
Right, exactly.
Thank you for being here. It's wonderful talking to you.
Okay, thank you.
And if you would like more information on the services available at Wing Memorial Hospital and Medical Centers, log on to winghealth.org.